I'm delighted to be here tonight representing the Kids First campaign, which is the sponsor of this candidates forum. The Kids First campaign is a statewide voter and candidate education project of Citizens for Missouri's Children, which is the state's leading child advocacy organization, advocating for the rights and well-being of all of Missouri's children, especially those at the greatest risk. Our goals are to educate voters about children's issues, to encourage candidates for state office, to address children's needs and their platforms, and to make the welfare of our children the state's #1 priority. Of particular concern to us is the alarming statistics regarding children's health care in Missouri. Estimates from the Department of Social Services indicate that there are now approximately 190,000 children in Missouri that do not have any type of health insurance. This is 1 out of every 8 children in this state. What is equally alarming is that that number has grown by more than 30% in just the past year. This is due in large part to tighter restrictions placed on family eligibility for the state's Medicaid program and the federal Children's Health Insurance Program, which the legislature passed in 2005. A recent study released by Families USA found that many of these uninsured children are not who you may think they are. More than 87% of them live in working families, and more than 1/3 of those are in families where both parents are working. In other words, the lack of health insurance is an issue that is affecting a much broader group of families than ever before. That's why it's so important for us to let our elected officials and candidates know for political office know that it's time to reverse these dangerous trends. Less than 10 years ago, Missouri was a model for other states in terms of how we provided for our children. Our levels of health care coverage for children were among the best in the country. Now it is becoming clear that children are no longer a priority in Jefferson City. Well, maybe not to everyone. And the situation is getting worse every day. What can you do about it? I'd like to suggest 3 things. You've taken the first step by coming here tonight to learn more and to question these candidates about where they stand when it comes to our children. Second, when you go to the polls in November, put kids first. Send a message about where you think Missouri's priorities should be. Finally, take a minute this evening to join the Kids First campaign by signing on as a member of our Children's Corps. It's easy, it doesn't cost anything, and it's a great way to add your name to a growing list of Missouri citizens who believe that we should put kids first. The more people whose names we can show to legislators as members of the Children's Corps, the more influence we will have in Jefferson City, and the more we will be able to achieve for kids. There are brochures on the tables and at the back and other materials about the Kids First campaign, as well as from our partner organizations, as well as sign-up cards, which we urge you to complete and leave with us at the end of this evening. You can also learn more about the campaign by logging onto our website at kidsfirstcampaign.org. I'd like to take a minute to thank our co-sponsors this evening, the Center for Family Policy and Research, Dr. Kathy Thornburg, Julie Gardner with the Association for the Education of Young Children, Jamie Schwartz with Rainbow House. They've lent their time, talents, and resources to us, particularly this venue, and we certainly want to thank them. I'd like to introduce Jamie Schwartz, who will be moderating this evening, and she'll give us a rundown of the program. Thank you.
Good evening, everyone. Thank you for coming out tonight. Thank you, candidates, for volunteering time. I know it's a busy time for you, but as being a part of Rainbow House, the state of children in Missouri is very important to us. The safety, preventing child abuse and neglect, that's what Rainbow House is all about. So we jumped at the opportunity that Citizens for Missouri's Children gave to us through the Kids First campaign. So we're really excited to be here. This is my first time moderating a candidate forum, so we're just gonna, relax and, mostly talking to myself more than anybody else. So, and I'm glad to see the little one back there. Never too early to start, caring about politics and getting involved in that whole process. Very excited. I'm going to start off by introducing you to the candidates that we have here. We've got 5 candidates with us. Mr. Paul Quinn, who is a Democrat from District 9 from Monroe City. Welcome. Mr. Skip Elkin, Democrat from District 21 from Hallsville, Missouri. Representative Jeff Harris, Democrat from District 23 from Columbia, Missouri. Mr. Jim Ritter, who's a Democrat from District 24 from Columbia, Missouri. Welcome. And Representative Judy Baker from who's a Democrat from District 25 and from Columbia, Missouri as well. So thank you, candidates, for being here today. The way this forum will go is that we have 4 questions that each of the candidates will answer that the sponsoring organizations along with Citizens for Missouri's Children have come up with. And each of you candidates will have 2 minutes to respond to each question. After we go through that series of questions, we'll open the floor up to questions from the audience here tonight. Thank you for being here again. There are index cards on your chairs and there will be pens passed around. Please feel free to write down your questions throughout the forum. There will be a representative from the sponsoring organizations collecting those cards, and I will be reading them for you. So please print so I can read them and not fumble over your words. I probably will anyway, but we'll get through that. Okay. Candidates, we have our timekeeper up here. This is Haley, and she'll be cueing you at 1 minute, 30 seconds to go, and then when it's time to wrap up. So if you keep an eye on her as you're making your remarks to keep track on your time. So without further ado, let's get started with the questions. Get in the hot seat over there. The first question for...
We have opening introductory remarks.
Well, yes. I say yes. How about 1 minute?
You're in charge. You can
Yeah,
say
I say
yes.
yes. Let's do 1 minute. So you cue on 30 seconds. 1 minute for opening remarks from each of the candidates. Let's start with District 9 here with Mr. Colquhoun.
First, I'd like to thank you all for having us. How important children are to all of us. They are our future. My wife Judy and I had 9 children, so very concerned about children. I think one of the most important part of life is to be positive, to have a positive attitude about our children. I know myself and my wife have run that attitude with our children. I think so many times that what we do, we become negative, and we got to be positive. We can make a difference, and I believe that. I believe if we take the time and work with our children, and work with them young, we can make a difference. One of the things was talked about was health insurance. One of the reasons I really got involved in politics was because of health insurance, and I wanted to make a difference in my life and my children's life, to take a stand on what I believe and what I think. I've tried to do that. I've tried to show my children what's right and what's wrong. Bob?
The dreaded red stop sign.
Don't worry, you'll have plenty of time to answer later.
Good evening. Thanks again for the opportunity to be here. My name is Skip Elkin. I'm in my 2nd term as county commission here in Boone County, and married 19 years to a lovely wife who's a public high school Spanish teacher in big town of Sturgeon, Missouri. We have 2 daughters. My oldest daughter is a senior in high school, and my youngest is in 7th grade. And our lives revolve around our children. And I think it won't be a shock to you that children's issues are very important to me. As county commissioner, we're involved in a lot of issues that affect children in our community. We've made a major investment in a community health center to provide health care to uninsured, underinsured, family health center. It's co-located with the City County Health Department. I also serve on the Mental Health Board of Trustees. Mental health, it seems like mental health trust issues are forgotten issues, and they affect a lot of kids, and I'll get into a little bit more later on that. Thank you.
Representative Jeff Harris.
Thank you. I want to thank you all for having this forum this evening. I want to thank my Republican colleagues for, I guess, in all sincerity, I've enjoyed working with Citizens for Missouri's Children. You know, in the 2005 legislative session, this governor cut funding for child advocacy centers, places like the Rainbow House. There are so many critical components in our system of taking care of children and making sure that kids have the opportunity to grow up to achieve the American dream. Part of that is early childhood education. Part of that is childcare. Part of that is making sure that if something happens to kids, there are places like child advocacy centers to take care of them. Part of that is access to health care. You know where I stand. I look forward to visiting with you this evening to explore these issues further. I just appreciate, again, working with you guys over the last 4 years in the General Assembly.
Mr. Jim Ritter?
Thank you. I didn't have 9 children, but my 3 felt like it. I've not worked directly with your program, but I've spent a lifetime career working with children and young people. I was an American history teacher and a counselor and administrator at Hickman High School, then was the assistant associate superintendent and finally superintendent of the Columbia Public Schools, and I have a passion for the issues that face our children and young people. When I decided to run for office, the 2 things in which I had greatest interest was the education of our children and the health care of our children and indeed the entire community. So I'm pleased to be a part of this team. Again, we're the Democrats that are going to do it right.
Rah, rah. All of us Democrats are really glad to be here tonight, and as you know, our presence tells you what our priorities are. I'm Judy Baker, and I'm the state representative for the district you're sitting in, and very proud to do so. Been here 2 years, and will be here 2 more years, and looking forward to working with all the child advocacy groups. You hosted me here at your center to show me your good work, and I can't tell you enough how much we all appreciate what you do. You know, a budget is a value statement. All of us have a budget in our households, and it tells us what we value. If you will take the state budget and look at it as a pie, the piece of the pie that has gone to children has actually shrunk in the past 4 years. That must be addressed. We can't just say our priorities are children and not back it up with our needs. And so we want to talk tonight about how we can do that. We pledge to you that we will look for ways to prioritize children in the budget coming up this year.
Thank you. The first question this evening is for all of you candidates. In spite of the generous eligibility for the state children's health insurance program, over 190,000 children remain uninsured in Missouri. Even those that do have health insurance are not always receiving the health care that they need, due in part to the shortage of providers. What is your plan to address the problem of children who lack access to high-quality health care? Mr. Quinn?
One of the things that I would like to see, especially, like for the businesses, that we would give them initiatives to provide health care, either a tax initiative or some type of, to make sure that all children are covered. I know myself, I was trying to say, and one of the reasons I ran was because I needed health insurance. It was important to me. It's important to all of us. And to me, when we turn our back to the most important people, our children, and not provide health care for them, it's wrong. Myself, I am a pro-life candidate, but I believe in life and giving good care for our children once they're born. To turn our back on them now, after they're born, is wrong. We have to take care of them all the time. We have to make sure they have quality care and raised right. And I believe that some way or another, our state has to look at that issue because it's very important to all of us.
Thank you. Mr. Falcon?
Before I say, give some comments on how we can move Missouri forward, move Missouri's families forward, let me tell you what I wouldn't have done. I wouldn't have cut 100,000 people off their health care insurance. Folks, these people are still getting health care. They're going to the emergency rooms. They're going to these community health centers to get health care. And what that is a big passing the buck down to local governments and local agencies, and to you and I, who end up paying for this in higher healthcare costs, higher insurance rates. That's what I wouldn't have done. Now, the state legislature, who's headed by Republicans, had a great opportunity this past session to pass legislation called the False Claims Act. We have found out that a lot of the waste and fraud that the governor was talking about is provider fraud. It's provider fraud. We have an opportunity to pass legislation, and if the standards for this criteria for this legislation exceeds the federal regulations, we can keep an additional, not only the recapture the fraudulent claims, but keep an additional 10%. What that will do is give us upwards of $500 million, possibly. We can reinvest that into the healthcare systems that were stolen from the working families in Missouri, reinstitute those cuts and recapture the federal money that we lost and get everybody back on health care. It's that simple. And we can do it without raising taxes. Another thing that I'd like to look at, and I've just got a few seconds, but we need to streamline the claims and reimbursement process. A lot of providers are not providing Medicaid because it's so cumbersome. We've got to streamline that. Thank you.
Representative Harris?
Well, in terms of providing more health care, increased access to health care for kids, as Skip said, certainly cracking down on corporate fraud, which would bring the state of Missouri up to $500 million a year, is one thing that has to be done. As Paul has said on other occasions, fraud is fraud is fraud, and we have to ferret it out, find it, and get rid of it, and capture those savings for the taxpayers of the state of Missouri. I think also, when we talk about persons who are applying for the Medicaid program, it would be useful to have those folks provide or identify who their employer is, so that we can look at the various sectors of Missouri's economy and see just who it is who is working hard, who's trying to play by the rules, but who lacks health care for themselves or lacks health care for their kids. As you know, as the question points out, we have, relatively speaking, a less ungenerous, if you will, approach to children's health care than we do for health care for adults, but still there are a lot of kids out there who are uninsured, a lot of kids out there who are falling through the cracks. So those are some of the things I think we need to do. I think also, to follow up on what these guys also said, we need to look at incentives, tax deductions, tax credits for small businesses to provide health care for their employees, and also look at ways for businesses to join together and use economies of scale to provide health care for their employees. We have to look at the healthcare system holistically, systemically, as a whole, and do the best that we can to make sure that kids are healthy, because if a child is sick, they're going to have a tougher time learning in school, and we're going to have all kinds of costs, monetary and otherwise, to our system.
Thank you. Mr. Ritter?
You know, I think we talked about 100,000 people being cut off of health care, and many of those people were children. Just put yourself in that position for a moment, that today someone told you you no longer had any health care, or you or your children. Think how we would feel as individuals. That's not happening to us, but it happened to 100,000 people and a number of children in that group. To me, that's one of the worst things that could happen to an adult. Can you imagine how those adult parents feel about their children not having insurance, not being able to get high quality health care when they get sick, as they have needs? I would see that as a panic situation for me and for my family if that occurred. And yet that's what we're dealing with here. We're talking too about even if you have insurance, some of these insurance programs, the MC Plus program, it's still hard to find providers. And one of the reasons for that is that we don't pay providers very well in this state. And so we need to look at that part of it as well, so that there are more opportunities for health care for our children than they've had right now.
Representative Baker?
The problem with going last is there's so many good things said before. They've done a really good job of succinctly putting what needs to be done. I'll add just a few things. I want all children in the state of Missouri covered, period. Every child should have access to health care. I've been in health care a good long time. This is not impossible. We haven't, there's been this misconception that the people who were cut off of health care were lazy poor people. That's not so. We've cut off 8 out of 10 children who are uninsured today are in working families. So my theory is, if we're going to have employer-based healthcare system, let's have an employer-based healthcare system. Employers need to step up to the plate and provide it, and if not, then the state needs to step up to the plate and provide it. We can't go around saying, all this is going to take care of itself. All of the problems have been laid out by my colleagues as to what happens when children are uncovered. It affects achievement in school. It affects attendance in school. It affects success in life. Everything we can talk about that we think is important for children is affected by the fact that they can't even see primary care provider and get just normal everyday routine things done. I would also echo what my colleague here on my right has said. One of our problems is access because of the low reimbursement rate to providers. I would say we need to raise the reimbursement rate to providers and make it so that they don't have to actually pay to see a child who's on Medicaid. I would also have an open enrollment period and no waiting time. There's a 6-month wait now for a child to get on Medicaid. Why should a child wait and risk being uncovered for 6 months? What difference does it make? Let's go ahead and have an open enrollment period for all children to be able to have access to health care.
Thank you. Well, let me tell you what I think. No. Time for the second question. And we'll start with Representative Baker this time. Switch it up. Get kind of crazy. All right.
You won't have anything to say at the end.
During the restructure of the Medicaid program, thousands of children, seniors, and individuals with disabilities will be forced to go without their needed health care services, and anyone who needs urgent care is more likely to face overcrowded emergency rooms. As such, the state needs to take a proactive role in protecting the health of families in our states. If elected, what would be your position and suggestion on the restructure of the Medicaid program? And what would you consider a viable option to solving the current Medicaid fraud issues that plague our states?
Good questions. I wish we'd been asking this question 2 years ago before we made these unnecessary cuts. And this is what we were saying 2 years ago before the cuts. What should we do to actually reduce the cost of health care? What we have done by doing these cuts is actually just shift the cost and bicker about who's going to pay for it. Now emergency rooms and FUHCs and providers are paying for the care that is being given. So instead of making that the debate, who's going to pay for it, it's really important that we address the problem in a systemic, comprehensive way so that we can actually reduce the cost. Sometimes that's having a medical home where a child and an adult has coordinated and managed care. And I don't mean that in managed in the old sense, but in the sense where we have some real strong oversight from a physician in a medical home setting where a child knows that they're being overseen and getting all of the immunizations that they need and all of the primary care that they need to prevent any incidents coming up. Corporate fraud. This is the fraud problem in our system is not the beneficiaries, which is what was attacked 2 years ago. Beneficiaries were attacked as being fraudulent. There's very few people that wake up today and say, I think I'll go to the doctor just to fraud the system. They go when they're sick. The fraud happens at the corporate level when we have dummy companies being put together and shell companies just billing without providing any services, double billing, transportation services that are double billing, and just in not having too much oversight. So we have, and there's lots of ways that we can go in and attack corporate fraud. There's many model states who have done it, and they've saved upwards of $200 to $500 million a year. That's a year potential savings where we could be providing care for our citizens. What we did is Missouri became a donor state when they made these cuts. Just like what my colleagues have said, we ended up sending $500 million to other states, including Massachusetts, who now has universal health care and all of their children will be covered on our dime. I want that to stop. I want us to address this in a systematic and comprehensive way.
Mr. Elkin?
I mean, I'm sorry, Mr. Ritter. We got reversed.
No, go ahead. Once Judy Baker talks about healthcare, it's pretty well said. This is her background and experience, and I'm learning a lot from her. But we have talked already about Medicaid and about children who aren't being served by Medicaid. And I'm becoming a strong believer in universal health care for children. Make sure that every child has that particular kind of health care. And never will I, with a meat cleaver, chop off 100,000 people, including thousands of children, in order to say that we're going to save money in the state budget. I've looked at this, and everyone at this table has, to see, what kind of savings did we get out of that? Well, 60% of those monies come from federal government, as Judy has indicated. We lost all those dollars to cut, 250 million, something like that, off of our budget. And then we lose money in that case. We go to the emergency rooms, and is that really a good place to take a child for health care? Because there's no one that keeps a record of that child, what happened last year, what's going to happen this year, some progressive records for children that seem to me to be so critically important. If we talk about finding up to $500 million of Medicaid fraud in the system, you more than pay for those 100,000 people. But when I talk to my friends about Medicaid fraud, the first thing they think of are the patients defrauding the system. The poor people out there are misusing. The ones that are using it, they will often think that those are folks that should have a job and they don't have. I just hear that. I say they're friends. They're kind of acquaintances. and they talk about it. But this is what they think. So we have to do something to show people it's not the recipients. It's often, and it's not generally the physicians who are providing care. It's other types of fraud that get into the Medicaid system. We just have to do something to make sure that doesn't continue to happen.
I don't have a whole lot more to add. Again, look at corporate fraud. I think we need to look at ways we can utilize the private market to increase access to health care. I think where the governor is going to go, if he, 2 years after they cut 100,000 folks off of health care, if he now decides he has a health care plan, where I think he's going to go is to an emphasis on managed care and an emphasis on health care rationing. I've heard things, we've all probably heard things to some degree. I know that there are other states that they're looking at, but I think those are probably the two places, the two directions, if you will, that he may go if he finally unveils some sort of plan. Again, a lot of questions out there. I think that we made a real mistake, though, not critically examining the budget from top to bottom, going after fraud in the system, recognizing that, in fact, we had a $250 million over collection in fiscal year 2006 that would have would have restored all of the cuts that were made in that same fiscal year. So there's a lot of work to be done, but those are some of the things I think that we're going to be looking at in the next session.
Ditto. I don't think we have to reinvent the wheel. I agreed with the governor when he campaigned on eliminating fraud and waste prior to making cuts. A promise that I might remind you that he broke. And I think there is certainly some opportunities out there to certainly eliminate the fraud and waste. There's a program in New York, it's called Verify New York, and what it is, and politicians are real, it's kind of an easy way out on an answer to say, okay, let's use technology to improve the system, but that's what I'm gonna do tonight. We're gonna use technology to improve the system. This system is a data mining software that it basically tracks providers and recipients that use the Medicaid and public assistance for healthcare. And it's an accountability program, folks. That's what it is. And it's extremely successful in New York. I think we don't have to reinvent the wheel. There are other states that are doing some things that certainly help eliminate the fraud and waste in our system. We certainly need to reinstate the cuts, again, I'll reemphasize, reinstate the cuts that were made and try to get baseline information to work from. Another thing, if providers knowingly commit fraud, we need to be tough on them. We need to go after them and make examples of them, and that's certainly another aspect. One thing I'd like to touch base on, the mental health, substance abuse issues that have almost been annihilated from the state. We need to really take a look at that because when our young people have mental health issues and sometimes co-occurring with substance abuse, that leads to other healthcare issues and it affects all of us. So that's something that as state legislator, I'm going to put a lot of emphasis on that. Thank you.
It's kind of nice to be last. One of the things that, Jeff was talking about in your last veto session, was brought up and that we need to address fraud. You know what I mean? And we've been in different candidate forums and for one, Mr. Rob, one of them said, made a comment that we got to be very careful about investigating fraud. To me, when we leave our children with not good health care, nothing should stop. We need to investigate every part of that. One of the things too, a lot of people think that different avenues, like we talked earlier about when we go to the emergency room, how the children now have to go to the emergency room. Well, what are people really thinking? What happens to our health insurance? Is your health insurance went down? No, we're going to pay for it. And I believe it's the responsibility of the state to take care of our children, to help our children, so that, that we might have decent care ourselves. Because our health insurance right now is going out of the sky because we're not taking care of our children. And we need to address that problem.
Thank you. Just to give each one of you a chance to go first. We're going to start with Mr. Elkin this time for our third question. And it is, quality early care is important to the success of children throughout their lives. Yet our current subsidy system serves only the poorest families and currently makes it very difficult for low-income parents to choose quality care for their children. What is the number one thing that would be most helpful in making high-quality early care more consistent for working families in your district?
Are you talking about healthcare or?
Early care as in daycare, or childcare, effective childcare, and early education.
There's, again, I don't think we have to reinvent the wheel and early childhood care. I think the statistics speak for themselves as far as, I think I read on the website today that every dollar we invest in early childhood care pays dividends of $11. I think that was the figure that I read. So certainly we need to invest in early childhood care, and I think that there's some programs out there that kids who and families, they don't know about these programs out there. So I think there's a big educational process that we need to go through as far as making sure families know about all these programs and early childhood care benefits are out there. And I really don't know a tremendous amount about early childhood care, but it's something that I will certainly have an open door and look forward to discussing these issues with your group and other groups as a state legislature.
Representative
Well, we always have to look at accountability in every program. I was reminded today, actually, I had forgotten about this. I think I even co-sponsored this legislation. It's the quality rating system that would be applied to early childhood programs. I think that is a way that we can sort of objectively assess how individual providers are doing and help consumers and help kids. That's something that actually I think Kathy Thornburg has been working on with my colleague Margaret Donnelly out of St. Louis County. So that's something I think we ought to look at, probably the number one thing.
Mr. Ritter?
Kathy Thornburg was a member of our Board of Education, so she worked on me for years and years on this. So what, after you retire from education, being in it for 40 years, you often sit back and think, what have I really learned in this period of time? And there are 3 or 4 things that are important to me. But one of the primary things, the conclusions I've come to, is that if we're going to do right by children, if we're going to close achievement gaps, we have to start with early childhood education. People in this room know about brain development. We do have a parents and teachers program, and a good one in this town, and I was very proud of that as part of the Columbia Public Schools. But we're not getting the right people in those programs. I mean, a lot of them are, understand that. But it's you and me that have our kids in it. We're excited about them learning everything. We're already providing a lot for them. We want them to have more. But people who have struggled in school themselves, they don't have great confidence in themselves, they may have been unwed mothers, they simply don't get involved in that program. In some way or another, we've got to come up with a plan to get those people involved in early childhood. Because, by the way, when it comes to kindergarten, it may be too late to close that gap. The kids are spread so far apart, don't know their letters from their numbers, no socialization skills, and others are reading at the 2nd grade level. You'll never close it completely, obviously, but you certainly slow it down. I feel really strongly about the fact that we've got to come up some way with a way to offer, and maybe, Illinois, I think, is going to kind of a mandatory, or at least, no, it's optional, but early childhood education, preschool programs for all children. And I think that has to be looked at if we truly want world-class education in this state. But I don't feel strongly about it.
Representative Baker?
He said ditto, I said woohoo. He said it really well. Of course, Jim Ritter is preeminent on childhood needs in our community, and we don't trust anyone better than him to address the needs of our children. I would have to say, if I could come down with one thing, it ties with what Representative Harris said. The rating system, I think, is a good thing to put in place, and I also co-sponsored that legislation worked on by Margaret Donnelly and Kathy Thornburg. We had a chance to talk about it when I was here. And if we could tie that rating system with the reimbursement system to incentivize people getting to the higher rating, then we'd have more places that actually meet the higher rating, and that way people would have more choices in their neighborhoods to go to. And if I could have a second one, I'm going to have some license here because you said one thing, but I think another thing is, I think some of our biggest problem is another misconception. Some of our bigger problems for this is in the rural areas rather than in suburban and, well put together areas like ours. We had a really great superintendent at one time. So our extension programs are really important, and whatever that we can get out to do rural development on these issues is a really important approach that we need to look at more sophisticatedly and move some more dollars out into those areas where it's most needed. Thank you.
This will be the 4th and final question that we have sent in the program, and then we're going to open it up to the audience members to ask questions of the candidates. We'll give each of them a chance to respond. For this 4th and final question, we'll begin with you, Representative Harris. The U.S. Department of Agriculture publishes a yearly report that estimates the cost of raising a child in 5 different regions. The USDA monthly cost to support a Missouri child 9 to 11 years of age is $652. Foster families in Missouri currently receive a monthly maintenance payment of $377 for a child this age. If elected, would you support raising the reimbursement to help support foster children to the USDA estimate? In addition, studies show that children in foster care tend to have poorer health outcomes than other children in the same economic bracket. What are your ideas on how to improve healthcare resources for current and former foster youth?
Well, I do support increasing the reimbursement rate to foster parents. They play a critical role in giving kids a nurturing, loving environment and giving kids opportunities that they might not otherwise have. In terms of other ideas, actually in the last legislative session, I sponsored a bill, and I wrote down the number because I knew I was coming here this evening. House Bill 2013, and we actually got a hearing on that bill in the Ways and Means Committee. It gives foster parents for state and local sales and use taxes a tax exemption for food and clothing purchased for their foster kids. It's another way, I think, in addition to increasing the reimbursement rate, it's another way to give foster parents some assistance. And you can do it pretty easily, same way that we've done other things like the sales tax holiday, for example. You're a foster parent, you go to the store, you want to buy a pair of tennis shoes for your foster child. I don't think you should have to pay sales and use tax on that purchase. So that's one idea I'd like to see us explore some more on sort of another related point. It's not foster parents, but it's adoption, which I think is part of the same continuum in many ways, giving kids who come into this world in difficult circumstances, maybe if we would do more to increase adoption in this state, adoption awareness. Regrettably, subsidies to adoption of special needs kids, as you all know, those subsidies were cut in 2005. Those cuts were invalidated by a federal district judge. The point is they never should have been made in the first place. And anything we can do to give kids a chance, kids who aren't born into perhaps the best of circumstances, and give foster parents some assistance and give folks incentives and help with adopting kids. And anytime we can do those things, I think we make our state a better place.
I have, on this subject, I have an advantage over some people in that I have been in a position throughout my life to see the effects of foster care on children. I've seen young people who were going astray, they were going down the wrong road, and when they got into foster care with people who really paid attention to them and did some things with them, they felt they belonged, would turn it around. And instead of being potential dropouts, they became good school citizens. So I feel very strongly about the foster care program. I've seen children who had been abused so badly going into the foster care program, and the next time you see them in the classroom, they're bright and shiny and excited. So the foster care program works. Now, we hear of abuses of it. I understand that. I understand everyone doesn't treat the children exactly right. And I think we need great oversight when we have foster care program. And I don't know how much goes on. I'm like Paul. I think we're learning from these forums as much as we give on those. I have a sister-in-law who was a foster parent. She had a little boy that she took early on as a baby. He had all kinds of issues. She took another little girl in at the same time. And I kept telling her, are you sure you know what you're getting into? Because sometimes this is tough. Well, I guess she did, because she adopted both of them. Not one of them, but both of those children. And they're now part of our family. And they've been with her 7 or 8 years. And, when we all get together, they're part of it. And they're children that wouldn't have had an opportunity. And the adoption came from foster care. Not because that she went out to adopt. That wasn't her intention, but she did it anyway. And so I would strongly support increasing the funding for the parents. Now, I recognize budgets, and I had to deal with one that was about $160 million and always short. So we have to always be cognizant of that fact. But I would support the idea of giving more to our foster parents.
You get the behavior that you reward. And what we did just recently is we actually went backwards and punished people who were in the foster care system. Parents that had stepped forward to take into their home someone they didn't even know. I think that we need to turn that around, and we need to, if that's the kind of behavior that we are wanting, then we need to reward it, and then we need to raise the rates that we support them up to national standards. Instead of being at the bottom of this barrel, we need to be at least up near the middle, and reward the behaviors that we so value, those who would take children into their home and take care of them. I also think that we leave foster parents sometimes on their own. Go through the whole process, there's a lot of paperwork, and there's a lot of waiting, and there's a lot of upfront activity, and then we leave them without too much support afterwards. I think that we should incent and encourage foster parents to participate in the Parents as Teacher program, so that they can get the supports that they need to learn parenting skills that they need. And we also need to ensure and have some kind of checkup system where we go back and we ensure that they are doing the medical and dental things that they need to do to be taking care of the child. So we need to be going back in and maybe we could do that through the Parents as Teacher program. Maybe we encourage them to be part of that program, and then we keep track of how much that they're actually doing to provide the medical and dental. Of course, we'll need to do that through the Medicaid program. So all of this is all tied together. That's what I'd like to see.
Mr. Wood?
I feel that we do need to raise the amount of money, like Ed, I'm sorry, whoa. Yeah, whoa, that was bad.
Wait a
Real
minute.
bad. I think I'll quit on that. No, I really believe that the most important part of anything is the parent. And if we, want good parents, you have to pay for them. And to me, it's very important that we search out good foster parents and pay them to do a good job. And like Jeff was talking about, giving them tax initiatives or anything to make sure that they work with them children, how important them children are. Like my wife, and after our daughter was killed, went into the school system to work as a special needs person. And how she would come home and talk about, the kids that she'd worked with, and part of them would be foster kids that just wasn't given a chance, you know what I mean? They were behind in the classroom, and how important that is. And she even talked about after that would maybe even be a foster parent, you know what I mean? And how that there is a need for that. But it's very important that we realize that we need good parents. We need people that are concerned, and you're not going to get people that are concerned about it if you don't help them. It's hard for a parent to subsidize a child coming into the house. Myself, if she'd have lived, she died 3 years ago, but if she'd have lived, I do believe we'd be a foster parent today. I know that. I mean, she had that empathy for kids and for people, and she taught me a lot.
Lots of good ideas up here, and as county commissioners, we deal a lot in the legislature with issues that are important from a local level, and sometimes the best offense is a good defense. And what I mean by that, and if I'm not mistaken, the leadership in Jefferson City cut the foster grandparents program last year. Sometimes a lot of these kids have a perfect opportunity in a bad situation to go with a grandparent, and by cutting the foster grandparent program, it just widened the gap, folks. It just made that gap between reaching the American dream further from some of these kids. So I think we need to take another look at the foster grandparent program. Absolutely, I'd look at increasing the funding, the reimbursement rate for foster kids. I'm going to take a sidebar right here, and as county commissioner, we get to deal with a lot of different agencies, and Judy mentioned Extension Council, and I want to recognize somebody in the audience that I've had the extreme pleasure of working with in my capacity as county commissioner. Art Gelder back here is an extension specialist, and we have the opportunity, he is involved in a program called Leadership Wrap, and that's a program where extension specialists go out to our juvenile justice center, which some of those kids in there are foster kids, and they give, they go through role modeling and decision-making skills, and they do a great job with these kids, and I'd like to recognize him for doing that. And I am extremely honored that we as county commissioners get to participate with these kids in these decision-making exercises that they go through. I think there's programs like that out there that certainly can absolutely change the lives of kids in our community, and I just wanted to mention that.
Thank you, candidates. We're going to open up the floor now to questions, and we're going to toss things up a little bit. You guys get to ask your own questions. So,
I trust you all.
yeah, if anybody gets inappropriate, I'm going to come and tackle you. But
I think
so,
these guys have gotten up way too easy. So not such a softball.
so does anyone have a question for the candidates? Oh, sorry. I'll work my way towards the back, so go ahead.
Representative Baker, you talked about the budget representing our values. But the process itself really confines how we can talk about that. In social services, we have a social services budget, social services committee, and so all you do is pit those vulnerable groups against each other. The argument is always, should it be kids, should it be the elderly, should it be the disabled? There really is not a venue for looking at that whole, well, in theory, the governor is doing that, but I don't think in practice it works that way. So any ideas from any of you? I'm not lobbing this question straight at you.
I'll take it.
But
You know, if you create an artificial budget crisis, you create that pitting everyone against each other. We ended up both years with a budget surplus. This past year of almost $300 million, $292 million budget surplus. And the revenues continue to increase, and this year as well. So if we had used all the money available, if we had had an adequate estimation, perhaps we wouldn't have had near the scraping and clawing that we've had in the past couple of years. So I would say that we've got to define our priorities, take out the budget. There are still a lot of things in this budget that are fluff, and we recognize that quite and said it on the floor numerous times where we thought the fluff was. And it was, you know, to the tunes of hundreds of millions of dollars that we could have saved. And, you know, so there's places where we have opportunity to even add on to that $292 million. So I think that there's enough. It's a matter of being good budget managers, good estimators, and prioritizing.
Candy, I don't think there's been a comprehensive analysis of this budget, certainly not in the last 2 years. And when I say that, I'll just give you a couple of examples. Frankly, they don't follow even the requirements of some of the statutes that they put in place. And I'll give you 2 examples there. One is this notion of performance-based budgeting. And I remember very clearly in 2005, we're dealing with the FY06 budget. I asked the budget chair on the floor, what amount of dollars, it's roughly a $20 billion budget total, a lot of that's federal money, what amount total did you subject this budget to the performance-based budgeting process? You know, where you're supposed to measure outcomes, and you understand. They said about 10. They thought about $10 billion. That means there was about 10 billion additional dollars that didn't undergo that examination at all. I asked another question. I said, and I don't remember the statutory number, but it's the Missouri Sunset Act that they also passed. It says after so many years you need to determine, or you look at a program and see whether it should sunset or not. I said, are we funding any programs that we're gonna sunset? I mean, are we putting money into a program that's gonna end? And frankly, they didn't really have a good answer for me for that. I wasn't asking those questions rhetorically. It's the law, we ought to follow it. It gave me the sense, frankly, the uncomfortable sense as a taxpayer, that I couldn't trust these folks with my checkbook. I proposed legislation, and I'm gonna propose it again next year. I'd like to see us as a state every 3 years after a bill is passed, go back and take a look, compare the fiscal note, the amount of money that bill is projected to cost or to save the state. After 3 years, fiscal oversight should go back and look at that bill and see if the fiscal note was accurate or not. I think it will give us a better way to improve our fiscal forecasting and fiscal analysis.
I'd like to echo what Representative Baker said about priorities. You know, when we look at the budget and, they're, giving $50 million tax credits to billionaire sports team owners in Kansas City, folks, it is about priorities. And, all these, you hear the budget officer saying how wonderful, all these excess revenues, but if you look at where those revenues are coming from, a lot of them, a substantial portion of all these excess revenues are corporate revenues, folks. And if you look at the revenues that are, I call them working family revenues, we're backsliding. That gap between the haves and the have-nots continues to widen. And it's a train wreck waiting to happen. And, the bottom line, it's about fiscal priorities and where we spend our dollars. And I can tell you that, and I think I can speak for the whole panel up here, that kids, healthcare, education, including higher education, those are all priorities for us. I mean, it's not a secret. And, we need to get back to the basics and get rid of the fluff that's still in the budget. And so working families can be in pace with corporations.
I mean, it's very important. The most important part of the budget, to me, is that you have to have priorities. You know what I mean? If you don't have priorities in education, you don't have priorities in families. To me, it's just like right now, the number of people that are going out against raising the minimum wage. My gosh, what are we talking about? Why not raise the minimum wage? Try to help everybody. You know what I mean? When we talk like $6 is wrong, what are we talking about? Where are our priorities? If we don't want to pay somebody anything at all, what do we expect out of life? You know what I mean? It's very important to me that we have priorities, and wages are part of our priorities, and families are our most important priorities. Our children are. I mean, if we're going to turn our back to them, we turn our back to everybody. And part of that wage part is turning our back to our children.
Well, the only thing I would add, and everything's been said, I think that's important, but we obviously have to decide what's important to us in the state and decide what our priorities will be. To me, our priorities are to our citizens, the welfare of our citizens, and that is education and health care, and that goes deeply into a lot of the things that we talk about tonight. I recognize fully that we have a finite amount of money. The state is very reluctant to increase that amount of money coming in any kind of taxes or anything of that nature. So what we're having to deal with is a certain amount of money for huge numbers of programs that are all important. All of them are important. And so when you go to a committee and you're putting senior issues against children's issues and all of that,
that's got to be a terrible experience. It would be a terrible experience for me, sitting on that committee, listening to those things, and thinking, I've got to take away from this one in order to give this to this one. That would indeed keep me up at night. So what I want to do, and every time I talk, my opponent tends to say, how are you going to pay for it? You know, where's the money going to come from? But I will say this, that we've got to find the money for some of these issues, and prioritizing how we spend our money, looking at every dime is what's going to be important, and thinking outside of the box, not doing it just because they did it this way last year.
Let me add one thing. We had about at least $50 million that we appropriated that they didn't pass the bill for. So that's $50 million we could have spent. I mean, it's just inadequate management of the budget.
The MOD program,
The MOD program. for
perfect
sure.
example.
And it's all very complicated, but some of the clawback money, and then the scholarships, all that put together, we wasted a lot of opportunity to have spent the money on Missouri citizens who paid it in.
Any other questions?
Recently in the federal government with the TANF program that all children now, sorry, my first time standing up. Should I stand up or sit down? But with TANF, they're now pushing people that are on TANF to go back into the workforce, no matter if you're in college or not. So this is pushing more of our state's children in childcare. So I just wanted to go back to the question 3 and just how that affected childcare. Because of their eligibility, I just feel like it's pushing people more into that poverty level and not helping people get out of it. So I just wanted to see, because you guys didn't really answer the question, but what was your, but the eligibility of DFS child care subsidy. And that is a huge issue for a lot of us that are here today, and they're not mothers, right? I'm a mother, I'm on DFS. I'm also on TANF too, and I'm also full-time working student, a 4-year-old child, and they're threatening to take away all my benefits from me because I won't work because I go to school, and I can't afford childcare because of what DFS says. And I just wanted to know what your guys' take on it was, what your eligibility is, raising the eligibility rates. I thank God for Head Start because their eligibility rates are so much higher than DFS is. And I just wanted to kind of understand where your guys' take is to raise that eligibility so that people that are being forced back into the workforce, that they can actually afford childcare and still trying to make a living and trying to get out of this poverty cycle.
Could you, there were a lot of questions.
I'm sorry, I'm nervous.
You mentioned, no, that's okay, that's okay. I just want to try to understand
Oh, you're fine.
where
I
you're
can
coming
sit
from.
back down.
You mentioned something about your eligibility, and I didn't get it all written down.
Oh, you're
Could
fine.
you explain your eligibility
the TANF
situation?
system right now federally, I'm a full-time working student. I worked in childcare for an agency, I can't say their name, or be, I worked for an agency for 4 years working with children in poverty, and I took the semester off so I could stay time with my son. I'm a single mom, and I don't have a good support system here. So I would be working all day and then going to school all night. That would mean my son's in childcare for, 12 hours, 13 hours? And it seems criminal to me, and we're pushing these kids out there more and more to childcare. You're talking about the rating system, and I was just wanting to see how the rating system and the eligibility for DFS, because I know I can't afford childcare and what DFS is giving me. So I just wanted to see what you guys were taking on that and what you guys can do when you get to the legislative season this spring. Because I know it's a huge concern, it's pushing a lot of people out there. Sure, you're cutting welfare down, sure, but you're pushing more people into poverty because of that. And I just wanted to know what the state and what your representatives are and what you guys just felt about that. And basically about childcare and the eligibility for DFS and how the rating system would affect that. Does that make sense?
I think so. I mean, one of the things you're talking about, I think, if I understood what you said, and I appreciate your standing up and sharing all this with us. No, seriously, I do. I think one of the things, and I think I'm addressing what you're asking. I apologize if we didn't get it before. I think one of the things you're saying is that you need more, if in fact the feds are gonna tell you that for various reasons, your child is going to be in childcare, right? Then what you're asking for is a little bit of assistance or a subsidy for childcare.
Yeah.
Is that right?
Yeah, and I can get DFS subsidy, that's not a problem, it's just that they don't give you enough because the
To-
eligibility rates, because they work on a sliding scale. So if I go, because I have an education, and so if I make $9 an hour, but still, that means nothing, that means I'm paying for everything, that means I would do better off staying at home than I would going out and getting a job. So that's just my thing, and the eligibility rates for DFS needs to be higher so that working single moms can afford something and step up when they're trying to complete their education.
It seems like it would be within our means. One thing I would like to see would be how much it would cost. I don't think it would be extraordinary based on what you're telling me. If you increase the eligibility level, certainly, you know, we've got a $20 billion budget, $7.5 billion in revenue annually. I think that's probably something. It may not be a panacea, but it's something that would address what you're talking about. On the other end of things, if you're a person's full-time in the workforce, I think we ought to do more to create incentives for employers to provide some sort of child care. Right now, we don't really have much of that. So those are just a couple of suggestions that I would make.
I'll just jump in real quick. You're describing a federal program. We were answering on a state level.
Yeah.
First of all, I don't mean to be defensive or anything.
Oh,
like
no,
that,
you're
but,
fine, I was just wondering about with DFS.
And just to let you know, we've seen this coming, and we knew that through the Balanced Budget Act that we were going to get cut in TANF and child care subsidy and child support. There's several really big things happening in the TANF reductions and in the Balanced Budget Act. And we know they're coming, and the Democrats have actually formed a task force to study that and have legislation ready for them this spring. Because what it's going to take is a state response. The feds are obviously reneging on their responsibility here, and you know, for a variety of reasons, I guess it's probably tied to the fact that we have this huge looming deficit at the federal level. So the states are going to have to respond, and we're actually studying that and working on legislation to respond. It will take, you know, it's one of those things that will take another appropriation as a response to the reductions.
And is there legislation going on right now to support people that are suffering from this right now in the state?
Well, my understanding was it wasn't going to take effect until October, am I wrong?
October 1st.
Yeah, October 1st, okay. So you're just now feeling the effects of it?
Yeah.
Our budget is not the same as the federal budget, so we heard about it near the end of session last year that this was going to happen. So we heard about it in April or May. So we're not able to do a budget until, you know, our budget won't take effect until July of next year. So hopefully we can get some, a line item in the budget this year to respond to those reductions.
Well, I don't have an answer to your problem. I wish I knew more about it, and I'm not as well acquainted with TANF and some of the issues you've talked about, but nothing bothers me much more than someone saying that I'm trying to work, but I would be better off not working because of the influence that has on your children when you're not working. If you're working, you're setting an example that we want to set for our children and young people. And not knowing the details, I can't say, well, by golly, I would do this or that. But I want you to know that that's important. I want you to know that I really appreciate the fact that you're willing to stand up in this meeting and tell us about that.
I honestly don't know a lot about TANF either, but I know that when you're working hard and playing by the rules and you're being penalized, it's broken. The system is broken when that's happening. And we see that not only in child care, but also health care. And, you know, I'd certainly be willing to sit down with folks who know a lot more about this than I do and try to find a solution. But I mean, and again, thank you for sharing that with us. And I think that we put the right minds together, I think we can come up with a solution to that.
I too want to applaud you for standing up. It's hard to bring an issue like that, and to me, it's like what I was saying before. I learned, and I am learning a lot tonight, and it's something that we need to do. I mean, it's need to address that issue, because you know, when a person's trying to get ahead and you're penalized for getting ahead, but we all want to slap you down and say, well, look at the people that are not working, and it's wrong. And I think anybody like you needs to have help, you know what I mean? We need to try to address the people like you that is wanting to make a difference. And what I hear the most important part is your four-year-old child, that you care. You care enough to want a good house, a good role model, and that means a lot to me. Your child matters, and that's what makes a difference to me. You know, so many times it's easy to leave a child behind because we want to further ourselves, but you want to give up a lot to make your life a better life, and I applaud you for that.
Can I ask a question? Could you tell us what you'd like us to do?
I would just
I mean, would you rather, while you're going to school, say you're a full-time student, would you like a program where you could just do that and have childcare?
yeah,
So
because
that
I
you
feel
wouldn't
like
have to be
what-
gone 16 hours a day and just to have the opportunity to go to school.
And there's a lot of, like, I go to the community college here, and there's a lot of people that are affected by this. And it's just, and where I live at, you know, because I live in public assistance, and a lot of people are affected by it. And I just feel like the state really needs to support the children. And like with the quality rating system, if you guys would, I just want to see how that would affect for parents paying the child provider. Like, would that affect us to pay them more because of quality rating system? Or will DFS help us pay? Because I know that will cost a lot of money just to do that. So,
I think that needs to be taken into consideration so that access to the higher rating is allowed for everyone to have access. Good point, thank you.
Other questions? Yes, ma'am. Right, you in the glasses.
Oh, okay. This was sort of directed towards Representative Baker just because you brought it up. I work with a lot of, sorry, I don't mean to keep going. I work with a lot of kids who have special needs, and you brought up the medical home. And it's very, very important for children who have special needs to have a medical home. But with my experience with the medical home, it's also very difficult to implement when a child needs several doctors, several therapists, and specialists on top of it. And the parents have a difficult enough time trying to raise their child with special needs, along with keeping track of everything that's going on and bringing the records from the occupational therapist to the doctor or the physical therapist to the doctor. And it seems like everyone kind of takes their approach that that's not my job. Like the pediatricians, you know, they have so many patients, their caseloads are so heavy that they feel that they're not getting paid for that, to keep records of all this. So my question was just, how would you implement that, or how would you get providers to do that?
Well, the question asked us what we'd want to do, so I was dreaming.
Yeah.
Thinking outside the box. I've been in healthcare a long time. And what we would need to do to make medical home work is to incent a provider or a group of providers. A medical home doesn't have to be just one provider. It has to be a group of providers that are communicating. There's opportunity right now that we've never had before, in that we now have, and I'm familiar with it and can share with you after. There is information systems now that can help actually integrate the providers in the medical home, which actually helps a lot. And then I just worked on a project actually in the Northeast to redesign the entire way we reimburse providers around quality and or coordination. So right now we don't reimburse for coordination.
So no one wants to do it if they're not gonna get reimbursed for it. Our entire reimbursement system is completely backwards. The best care, usually done by coordination these days, is not reimbursed at all. So we would need to completely flip-flop that around and actually reimburse for that.
Anything else?
I don't know a lot about it, but, and I'm not sure I understand your definition of medical home. But, right now, I serve on the Boone County Family Resources Board and formerly Group Homes. And I think that they do an outstanding job providing OT and physical therapy and such, and it's all, and it's a great model because it's all individual based. It's not home based or it's based on individual needs, and it's a great model. And I know that Les Wagner, the executive director, has talked a lot about physicians and therapists and the billing process, and certainly there's some opportunities, challenging opportunities to improve that system. And I can tell you there are some physicians who are, we talked about them not wanting to provide those services. There are physicians out there who provide more than what is being asked for them in other therapies. And I think that, again, the system can be improved upon, and not every area is the same as when you talk about providing OT and PT to individuals in the area. But I think the model works pretty good here, and I think there are some ways that we can make it better from the state side of things. So anyway, just
not from the doctor point of view, special needs. My daughter, that's what she works with, special needs children. And she did. She worked the last 2 years. She had a child that the parents asked her to work with. She was going to college. And anyway, that she worked with an autistic boy when he was 3, when he couldn't talk, he wasn't potty broke. Today, that boy's 5. Been working with him maybe a little over 2 years, okay, at night and on weekends. But that boy today is able to talk. He's in school. He's in kindergarten. The only thing right now, he can't formulate a sentence real good, but the teacher said he's one of the smartest ones in the class. And how important it is to me to watch her. And I remember we were at church one Sunday, and we sat in the second row from the front. And anyway, well, that was right after my wife died, and she hit me and said, "Dad, did you hear that?" And I said, "What?" "Hear that?" And it was the little boy that she worked with, and he walked in the church and he said, "All done." and how, just such 2 small words, how that, if we take time to work with kids, you know what I mean, and special people that can work with them, how this boy may be blessed to have life.
At foodsleuth@mchsi.com. Thanks for watching.